Hello everyone, welcome to my channel Dr. Shil's Physio Victory. Today is the second part of AIIMS CRE question analysis 2025 December question. Let's start. Today's first question is lumbar flexion is commonly measured using option A slump test, option B Schober test, option C straight leg rising test or SLR test, option D Faber test. Here the correct answer is option B Schober test. Slump test is particularly for sciatic navigation. SLR test is for nerve root compression. Faber test is for SI joint pathology. Next, come to question number 27. Most common level involved in lumbar disc herniation is option A L2 L3, option B L3 L4, option C L4 L5, option D L1 L2. Here the correct answer is option C L4 L5. Among the disc herniation, L4 L5 contributes to 45 to 50%. After that, L5 S1 contributes to never about 40%. Next, come to question number 28. The earliest and most common symptom of osteoarthritis is option A pain and rest, option B morning stiffness, option C pain on movement, and option D joint swelling. Here the correct answer is option C pain on movement. Osteoarthritis is a degenerative joint disease where cartilage breakdown leads to pain, primarily during or after joint use, known as mechanical pain. Next, uh, pain at rest is more common in advanced way or inflammatory conditions like rheumatoid arthritis. So, rheumatoid arthritis, pain at rest, morning stiffness uh, is basically also for rheumatoid arthritis, joint swelling of for synovitis. Next, come to question number 29. Pursed lip breathing is most beneficial in patients with option A asthma, option B pneumonia, option C COPD, option D restrictive lung disease or RLD. Here the correct answer is option C COPD. Pursed lip breathing involves inhaling through the nose and exhaling slowly through pursed lip, creating positive end expiratory pressure. In chronic obstructive pulmonary disease, particularly emphysema, it prevents airway collapse, reduces air trapping, improves oxygenation, and decreases dyspnea by prolonged expiration. Next, come to question number 30. Incentive spirometry is primarily used to prevent option A bronchospasm, option B, pneumonia, option C, atelectasis, option D, COPD, ex- exacerbation. Here, the correct answer is option C, atelectasis. Incentive spirometry encourages deep, sustained inspiratory efforts using a device with visual feedback. It's primary preventive or it's primarily preventive for atelectasis post surgery. It also improves ventilation perfusion matching and reducing shallowing breathing risk. Next, come to question number 31. Contraindication for aerobic exercise training during pregnancy is option A, mild back pain, option B, anemia, option C, diabetes mellitus type 1, option D, post labor period. Here, the correct answer is anemia. Option B, anemia is the correct answer. Especially if moderate to severe anemia, uh, there is contraindication because it reduces oxygen carrying capacity and which leads to increased cardiac stress during exercise. Next, come to question number 32. Which of the following is not a closed kinetic chain exercise? Option A, squat. Option B, lunges. Option C, leg press. Option D, biceps curl. Here the clear answer is option D, biceps curl. Next, come to question number 33. Steppage gait is due to injury of option A, sciatic nerve, option B, common peroneal nerve, option C, popliteal nerve, option D, radial nerve. Here, the correct answer is common peroneal nerve. Next, come to question number 34. Botonier deformity is characteristically seen in option A, osteoarthritis, option B, rheumatoid arthritis, option C, ankylosing spondylitis, option D, gout. Here, the correct answer is option B, rheumatoid arthritis. In osteoarthritis, basically, Aberdeen's nodes are found. Ankylosing spondylitis basically involves primary spine. Next, come to question number 35. T-score value indicating osteopenia is option A, -1 to -2.5, option B, below to -2.5, option C, greater than 2, option D, greater than 3. Here, the correct answer is -1 to -2.5. It indicates osteopenia in DEXA scan. Below -2.5 to -4.5 indicates osteoporosis. Next, come to question number 36. In frozen shoulder, after external rotation, which movement is restricted? Option A, internal rotation, option B, abduction, option C, flexion, option D, external rotation. Here, The correct answer is option B, abduction. So the capsular pattern is external rotation, then abduction, then internal rotation. Next, come to question number 37. Roos test used for option A, cervical rib, option B, thoracic outlet syndrome, option C, median nerve, option D, ulnar nerve. Here, the correct answer is thoracic outlet syndrome. Next, come to question number 38. Medium frequency current used for option A, pain relief, option B, muscle stimulation, option C, wound healing, option D, none of the above. Here the correct answer is option B, muscle strengthening. Medium frequency currents are used for muscle strengthening by delivering comfortable and deep stimulation to elicit contraction without skin irritation. Next, come to question number 39. High penetration current is option A, galvanic current, option B, Faraday current, option C, short wave diathermy, option D, Russian current. Here, the correct answer is option C, short wave diathermy. Short wave diathermy uses high frequency electromagnetic wave for deep tissue heating. Next, come to question number 40. When a patient uses a cane to ambulate, the patient will hold the cane on the option A, same side, option B, both side, option C, opposite side, option D, alternate side. Here, the correct answer is option C, opposite side. Holding the cane on the contralateral side to the affected leg provides support during the swing phase, reducing weight on the weaker side and improving balance. Next, come to question number 41. Heliotherapy, also called option A, ultraviolet therapy, option B, phototherapy, option C, sun therapy, option D, actinotherapy. Here, the correct answer is option C, sun therapy. Next, come to question number 42. Tennis elbow is also known as option A, medial epicondylitis, option B, olecranon bursitis, option C, lateral epicondylitis, option D, golfer's elbow. Here, the correct answer is option C, lateral epicondylitis, golfer's elbow, or medial epicondylitis is the same thing, and olecranon bursitis is also called the student's elbow. Student's elbow. Next, come to question number 43. Trendelenburg gait occurs due to weakness of option A, gluteus maximus, option B, gluteus medius, option C, option B is gluteus minimus, and option C is gluteus medius, option D, gluteus medius and minimus. Here, the correct answer is option D, gluteus medius and minimus. Next, come to question number 44. Lower brachial plexus injury leads to option A, AIIMS palsy, option B, Klumpke's palsy, option C, wrist drop, option D, shoulder drop. Here, the correct answer is option B, Klumpke's palsy. This basically affects C8 to T1, causing hand intrinsic weakness, claw hand, and Horner syndrome if T1 is involved. And Erb's palsy is upper brachial plexus injury, which involves C5 to C6, and wrist drop is radial nerve involvement. Next, come to question number 45. Normal wrist radial deviation range of motion is approximately option A 0 to 20 degree, option B 0 to 10 degree, option C 0 to 15 degree, option D 15 to 25 degree. Here the correct answer is option A 0 to 20 degree. Next, come to question number 46. Red flag for low back pain. Option A, numbness. Option B, cancer. Option C, bladder bile dysfunction. Option D, radiating pain. Here, the correct answer is option C, bladder bile dysfunction, because it is due to cauda equina syndrome, and it's an absolute red flag indicating urgent need for imaging or surgery. Next, come to question number 47. Exercise for cardiac phase 2. Option A, in hospital. Option B, after 6 months. Option C, after discharge. Option D, after 1 year. Here the correct answer is option C, after discharge in hospital. That is phase 1, and after discharge the phase is phase 2, from 4 to 12 weeks, especially supervised aerobic exercise. Supervised aerobic exercise. Next, come to question number 48. Disc herniation commonly injures which nerve? Option A, superior gluteal nerve. Option B, dorsal scapular nerve. Option C, sural nerve. Option D, sciatic nerve. Here, the correct answer is option D, sciatic nerve. Next, come to question number 49. ACSM guidelines for a diabetes mellitus patient exercise. Option A, 4 to 6 hours per day. Option B, 6 to 7 days per week. Option C, 4 days per week. Option D, 2 to 3 days per week. Here, the correct answer is option B, 6 to 7 days per week, where 3 to 5 days of aerobic exercise and 2 to 3 days of resistive training. Total of 150 minutes per week. Next, come to question number 50. Clinical tests used for diagnosis of tennis elbow includes option A, balance test, option B, Maudsley's test, option C, Darken test, option D, Tinel test. Here the correct answer is option B, Maudsley's test, because other three options are used for basically CTS or carpal tunnel syndrome. Thank you everyone for watching this video. Please do like, subscribe and comment. If you found any question or answer is wrong, please pin me on the comment box. I will try to check it out and share it with your friends if you found it helpful.